So types of glaucoma, as we discussed earlier, that on the basis of age of the patient, there is congenital glaucoma and developmental glaucoma. Congenital glaucoma means glaucoma present at the time of birth of the patient. So what happens in congenital glaucoma? There is maldevelopment angle structures, as we discussed in previous video, that suppose this is the cornea, this is the sclera, and it is divided anterior chamber and posterior chamber. This one is anterior chamber and this one is posterior chamber. So behind the posterior chamber there is lens. Now aqueous humor is produced from uh, the ciliary body from posterior chamber produce aqueous humor, and that aqueous humor from posterior chamber flows into anterior chamber, and from anterior chamber it goes into trabecular meshwork and then into canal of Schellham, and then uh, through canal of Schellham, episcleral venous plexus, subophthalmic vein, and finally aqueous humor drained into cavernous sinus. So that is normal flow of aqueous humor. But in congenital glaucoma, what happens that this flow of aqueous humor is obstructed in any of the its pathway, causes elevated IOP, and congenital glaucoma develops because of maldevelopment of angle structures, causes impaired aqueous outflow and raised IOP greater than 21 mm of mercury. Congenital glaucoma is also classified into true congenital glaucoma and into infantile glaucoma and juvenile glaucoma. In true congenital glaucoma, there is elevated intraocular pressure, uh, intrauterine life, and child is born with ocular enlargement. When we will look at the patient, he will have ocular enlargement. In infantile glaucoma, there is the manifestation prior to child's third birthday, means when patient becomes uh, greater than 3 years, then if he develops glaucoma, that will be the infantile glaucoma. And juvenile glaucoma, when young adults, like boys and girls, develop glaucoma, are the boys or girls of 3 to 16 years, if develops glaucoma, then that will be the juvenile glaucoma. There is a congenital. So what will be the signs and symptoms of congenital glaucoma? There will be the photophobia, irritation when patient will look at the light, there will be photophobia, irritation occurs, lacrimation, and blepharospasm, enlargement of eyeball. These are the symptoms of the patient. There will be blepharospasm, and there will be lacrimation, photophobia will be observed by patient. Patient will complain, if patient is very young, then there will be no complaint, but mother will observe that there is the photophobia to the patient. So these will be the uh, symptoms of the patient, and signs will be corneal edema, corneal enlargement because elevated intraocular pressure. Their iris shows iridodonesis and atrophic patches in the late stage. Lens become flat and subluxated because of intraocular pressure causes subluxation of the lens, and optic disc shows there is cupping in cup to disc ratio, and atrophy of optic nerve will be observed. Intraocular pressure will be raised in the patients of congenital glaucoma. So in congenital glaucoma, there will be the cornea will be enlarged, lens will be subluxated, and lens will be subluxated to the patient of glaucoma, and then the optic disc will be the optic disc cupping, cup to disc ratio will be increased, and IOP will be raised in the patient of glaucoma. These are the signs of the glaucoma patient. So how will we assess the patient? That we assess visual acuity and perform